Taoiseach, I remember 3 or 4 years ago you spoke in very convincing terms at the time about dramatically reforming the health service and money following the patient and the Dutch model, and everybody would be treated in time and nobody would have to wait ever again. Well, the figures published last Friday give a different story. One in every 8 patients now on a hospital waiting list are on the queue for over a year. That's 50,000 patients on an outpatient waiting list for more than 1 year. And Taoiseach, that's a 400% increase going from January to now. If you look at Tallaght alone, for example, Tallaght Hospital, close to 7,000 patients waiting for over a year. And in Waterford, you're looking at 6,342. And the figures are bad elsewhere as well, over 4,500 in Galway and so forth. And you look at the inpatient waiting lists, and again, 46,000 people waiting for more than 8 months for a hospital appointment. That's your target, 8 months. You set that, which was a higher target than previous targets. And the issue has absolutely soared in terms of, in the inpatient, you've soared, from 1,764 to about 9,693 in about 7 months. That's a 450% increase. There are about 5,000 children waiting on an inpatient waiting list, about 2,000 of those for longer than 20 weeks. And 20 weeks was again a target that you set. Now, when the treatment purchase fund was in place, it had set a target of 3 months for children and 6 months for adults, and had, broadly speaking, achieved those targets across most of the disciplines and most of the areas where people required elective surgery. Minister Riley came in and he changed those targets arbitrarily. He got rid of the treatment purchase fund, and we've had dishonest and flawed budgets since. 200 million was taken from hospitals in last year's budget, and we know how flawed and dishonest the budget that was. You got rid of the treatment purchase fund. There's been appalling mismanagement, and we have a huge number of consultant vacancies, over 200 vacancies now in hospitals in relation to consultants. The question I want to put to you, Taoiseach, is that Minister Varadkar is saying that it's going to get worse before it gets better. Can you quantify for me how worse it's going to get in terms of children having to wait and in terms of adults having to wait for hospital treatment? And do you accept that your commitments, the commitments that you personally gave 3 or 4 years ago in relation to waiting times and waiting lists, are simply in tatters now, and that urgent intervention is required to turn this around?
Thank you. Taoiseach.
Yeah, well, you spoke fairly convincingly yourself a number of years ago when you said you'd end waiting lists permanently. I remember that. You made great play of it, and subsequently you accepted no responsibility for anything that happened in the Department of Health. If I recall correctly, back in 2007 there were just over 6,200 patients on the inpatient and day waiting lists for over 12 months. That's well, it's nothing great to shout about. This year it's down to 1,800 who are waiting longer than 12 months. The total number of inpatient and day case waiting lists at the end of September this year.
Sorry, please.
Yeah,
Sorry.
actually, I'll give you the numbers if you want. The total number of patients on inpatient and day care waiting lists at the end of September this year is 59,902. And of these, 9,693 adult cases have exceeded the wait time of 8 months for a procedure, and 1,930 children have exceeded the target paediatric time of 20 weeks for a procedure. Well, we can't be happy about that, not meeting all the targets there in relation to children. It does mean that 4 out of 5 people are receiving treatment within target times. Now, this morning the government approved the draft service plan submitted by the HSE to the Minister for Health. You are aware that over 600 million extra has been allocated for health for 2015. There was an overrun of 510 million. Will allow for some changes to be made. In September this year, the number of patients waiting in excess of 12 months for an outpatient appointment has actually decreased from 84,000 167 to 41,604, which is a reduction of 51%, Deputy, when comparing the same periods in 2013 and 2014. It's down from 84,000 to 41. Up to the end of September this year, there's been a 3% increase in outpatient attendances compared to 2013. That's 64,289 more patients actually seen, despite the fact that expenditure in the health service has gone from 16 billion to 13 billion. So although the increased provision and the uptake of outpatient appointments is positive, obviously that's going to result in some additional demand for inpatient and day cases. In primary care, I understand that waiting times for physiotherapists and occupational therapists has decreased, and there's been an improvement in the end-of-life care and childhood health surveillance. But you can see where the demand is coming from, Deputy Martin. In the first 9 months of this year,
Thank you.
from January to September 2014 compared to January to September 2013, the new ED attendances were up by 3.5%. The ED admissions were up 2%, including a 13% rise in overnight admissions through the AMAU system. Outpatient attendances were up 3.8%, as already mentioned, as part of the outpatient waiting list initiative, which was facilitated in part through appointments during additional working hours. So, you know, that's going to have an effect on elective waiting lists. So these things are never as you would want them to be. Can I give you a projection of what the numbers will be in the future? I can't, except that the changes that will be made following the approval of the health service executive plan by the government this morning will have an impact on the health services in general.
Deputy Martin.
Taoiseach, just before the last general election, I never heard that phrase before. These things are never what you want them to be. That wasn't your tone or your entire disposition. It was actually much different to yours.
Sorry.
Much different to yours.
Supplementary question, please.
If you actually had left well alone, Taoiseach.
Sorry, would you
If you had left well alone, Taoiseach, things wouldn't be as bad in the health service as they now are. I mean, you know that yourself. That's why you got rid of Minister Riley. The thing was a mess, and it was in tatters. And all I said to you at the outset was that the number of adults waiting for more than 8 months, which is a target that you imposed, the original target was 6 months, by the way, and the Hospital Treatment Purchase Fund was meeting that target. And you got rid of it. It went from 1,700 to 9,693 in adult inpatients alone. And the same in relation to children. Your target, 37% are waiting longer than the target you yourself has set. And the real reason, Taoiseach, is you starved health last year. And you brought in a false budget. I'm not allowed to use the word lie here.
Deputy. Would you put your
But essentially, a lot of porkies were told to deputies 12 months ago in relation to the health budget. And that's why hospitals, who were cut by 200 million, could not meet the targets, the impossible targets that you set them, because you starved them of the funds. And you mismanaged the whole consulting situation, with the result that there's very serious vacancies across the country, in the Mater, in Tala and elsewhere, where you don't have consultants in place now because of the mess that was made.
Deputy, way over time.
Are you saying, Taoiseach, that in the health service plan that you've just approved, will that 200 million that was taken from hospital acute budgets last year, acute hospital budgets last year, will that be restored now?
Thank you.
In the context of the health service plan that's going to be published this week, yes or no?
Thank you.
Well, the government approved the health service plan submitted by the HSE to the Minister for Health this morning. The Minister will outline details of that this week in terms of the extra resources applied to health and how that's going to impact on the major areas of frontline services. I'd say to you again, in September, the number of patients waiting in excess of 12 months for an outpatient appointment decreased by 51%, from 84,000 to 41,000. Now, even you, with all your knowledge and with all your memory, cannot indicate what might arise in the future in terms of the health services with winter flus or winter vomiting bug or whatever else. And you were there for long enough. You never actually discovered what happened every January and every February. Actually, you never actually discovered what happened every January and every February for years, where the system backed up. And the reason was that when those in the medical profession went away for their winter holidays, there wasn't a situation left for cover in theatres and operations to continue. And that's what caused the backup every year for as far back as I can remember. And there you were, you never even looked at that.
you.
In any event, what we want to do, Deputy Martin, and the medical profession themselves will tell you, there's now far more being delivered with less because of greater efficiencies. And the 600 million extra allocated for the health budget for 2015 is now part of the programme approved by the government today, as submitted by the Health Service Executive. And the Minister will give the details of that later in the week.
Thank you.